In this video, I'm going to talk about what recovery typically looks like in the first 7 days after having a knee replacement. I'm Matt Sigua, a doctor of physical therapy, and I've treated hundreds of patients who had knee joint replacement surgery. And if you're planning on having one soon, then this video is especially going to be helpful for you. Before we get into the video, please subscribe if you find this helpful. Now, let's get started. So, the symptoms that are very common after having knee replacement surgery in that first 7 days are pain in the knee joint, obviously, swelling around the knee joint. So, that's also going to be above and below the joint. So, sometimes you can have swelling at the thigh and all the way down to the foot and ankle on that surgical side. And the third symptom that almost everyone actually has is some kind of bruising around the knee. One of the most common places that people don't expect is actually having bruising at the thigh, specifically on the back of the leg, so your hamstring. You can have some bruising there as well as the ankle and around the foot. Sometimes I get patients who are, I'll see them, whether that be their first, second, or third visit, and they'll say, oh, I have a lot of bruising in the back of my thigh or even at my calf or ankle. They're like, did something go wrong? Is this something to be concerned about? Any like red flags here? So bruising is definitely very common. No need to have any concern there. The main, red flag, the main symptom that we want to specifically be on the lookout for is a DVT, so a deep vein thrombosis. So typically the signs that we'll be able to spot this is you're going to have extreme pain in the back of the calf on the surgical leg. It's going to be very tender to the touch. So if you try to touch it, you're going to have a pretty strong reaction, but also it'll be warm to the touch. It's going to be, the temperature is going to feel pretty warm or pretty hot. And also you might have extra swelling, extra bruising at that calf. So if you're having even like any of those symptoms, or especially a combination of hot temperature, very, very tender to the touch, or painful calf, and extreme increase in the swelling around the calf, then that's when you want to alert your PT and the office, the surgical office. Usually they'll give you a number for emergency services if you're suspecting some kind of DVT symptom. So as long as you rule that out, so for example, if you have bruising on the back of your calf, but it's not painful to touch, to squeeze, temperature wise, it's very cool, or even like swelling wise, it's relatively normal, then you don't have to worry about that. But that's just the main thing that you want to look out for related to DVT. But bruising anywhere on surgical side, surgical leg is going to be expected, so don't be worried about that. So those are the symptoms that you're going to see. Now, what your function is going to look like is going to be actually similar to what your function would be like if you're having hip replacement. So with a knee replacement, we're still avoiding any heavy lifting, so you're not going to be doing much laundry. You're not going to be taking or putting anything and taking anything out of the dishwasher. So no heavy lifting, no extreme bending. So you're not doing any deep squats. You want to make sure that if you have stairs, if you have a multi-story home, you want to avoid how often you're going up and down stairs. What I usually tell my patients who can and have the opportunity to is sleeping on the ground level floor, the first floor, so you avoid having to go up and down stairs to go to sleep or go to bed. That's going to make a big difference in your recovery, because then the more that you're doing the stairs, it's just going to cause more inflammation and more pain and swelling at the knee, and it's not necessary, right? Now, if you have no other option, you have to, then that's why we practice doing some kind of stairs, usually before you're discharged from the hospital, because they'll ask you, do you have stairs at home? And if you say yes, they're gonna have to make sure that you can confidently do that, so you can just perform that at home as well. But if you have stairs and you can avoid it, we want to say stay on the ground level floor that first 7 days, that first week, just to keep the amount of inflammation on the minimal side. Now, in terms of getting in and out the shower, same thing that kind of applies to hip joint, but the main thing is you have to get cleared by your physical therapist to take a shower. You're definitely going to need a shower chair to be the most safe, or a shower bench, so that if you're in the shower, like once you get to that point and you're trained how to get in and out the shower by the therapist, sitting down is the safest way to do it. So then that way you reduce the fall risk, because the floor is going to be slippery. You're going to have less balance and stability in that surgical leg in general. So doing something where you have to bathe yourself using one or both hands, and you're not going to be able to rely on both hands to keep you stable, is why the shower chair or shower bench is going to be best to prevent falls. Now, in terms of your overall walking function, that first 7 days, you're going to be up and moving pretty much every day as long as your symptoms tolerate it. And again, you're going to be cleared by your PT of what's appropriate for you specifically on each day to make sure that you're not overdoing it, because your symptoms will increase if you do too much walking or too much standing. We have to balance out how much exercise, how much movement we're doing. So you don't want to be on either end. You don't want to do too little where you're lying down on bed or on the couch all day. And you don't want to do too much where you're up for 30 minutes to an hour at a time on your feet. You're definitely going to have more pain and symptoms if you do so. Now, in terms of the assistive device after a knee replacement, during the first 7 days, you will primarily be using a front wheel walker or any kind of walker. But ideally, it's the walker with 2 wheels in front and then 2 stable legs in the back. Now, some people will try to, same thing as the hip replacement, where you might feel pretty good, whether that's regarding your pain or whether you feel pretty stable. I've had a lot of patients who felt pretty strong and balanced without a walker and using a cane. However, that first 7 days, our goal is really just to keep inflammation and swelling down so your knee just really optimally heals. So the less pressure, the less impact that you have on that surgical knee, and you can use your arms to offload some of that weight onto the walker, it's just going to allow you to move better. You're going to have less pain, less swelling. So you might be capable of moving and walking without it, but that 7 days, it's strongly suggested and recommended that you use a walker versus the cane, even if you're able to use a cane. Okay, so very important is, what are your post-op precautions? So what that means is, what are the movements and the positions you definitely want to avoid in the first 7 days after having knee replacement surgery? Now, it should be said that every orthopedic surgeon is going to have slightly different precaution or their own specific precautions and protocols that they want you to abide by and comply with. So you'll usually hear that from the actual orthopedic surgeon, their physician assistant, or their medical staff, and usually they'll give you some paperwork that says, oh, do this, don't do this. That's the number one thing you go off of. But what I'm going to talk about are just some general guidelines that most orthopedic surgeons go by in that first 7 days. So with the most common protocols, 90 degrees is definitely the stopping point that you want to aim in terms of bending your knee. So it's hard to eye that. Sometimes you can get a good general sense of what 90 degrees is, but that first 7 days, most people would not be bending their knee at 90 degrees, but the main thing is you definitely don't want to push that knee past 90 at 7 days post-surgery. You're really just trying to keep that swelling down, just trying to let the knee heal. And if you overbend it, you have the incision that's still healing even at 7 days post-op. So if you overbend, then you're going to cause the incision to possibly open up, which will significantly affect the healing. So 90 degrees is the cutoff. What I tell patients to go by in that first 7 days is, we want to work on bending the knee, but it has to be in a tolerable range. So your pain level has to be under 4 out of 10. So if you can stay between 1, 2, 3, 4 out of 10 pain while you're doing the exercise, that's ideal. Once you go past 5 and you're in the higher pain levels, now you could be causing more damage. Then that's actually going to help you. So stay in a lower pain range, and then definitely avoid bending past 90 degrees at your knee. Another thing you also want to keep in mind is when you are standing up, when you're sitting down, so you're doing a sit to stand transfer, you want to try to keep your surgical knee out in front of you, kicked out with the knee straight, so you take pressure off of that knee. This is more of just a tip to help you keep pain and discomfort at a very minimal level. So if you were to try to sit down or stand from a chair or even from the bed with both knees bent evenly, you're definitely going to feel pain. So one key to help keep your pain to minimal is, before you stand up or before you even sit down, have that knee that you had the surgery on, have it straight, kicked out in front of you, and then you're going to be using your arms and your other leg to either help you stand or sit down, but you don't want to perform a sit or stand with that knee bent. You're going to feel a big difference in terms of pain and discomfort. All right, hopefully you enjoyed that video. If it was helpful, please subscribe to the channel, and I'll see you in the next video.